Thank you, Deputy Presiding Officer. The American Declaration of Independence declares that people have certain inalienable rights. Among these are the right to life, liberty and the pursuit of happiness. Happiness is something that's not attainable for those with poor mental health, and we need to tackle this to enable children to grow up leading fulfilled and happy lives. We need to ensure that good mental health is also a right for all our citizens, to help them with their pursuit of happiness. We need to start at a young age, helping young people develop resilience and emotional well-being, issues highlighted by Action for Children in their submission to the report. The Health and Sport Committee's report makes stark reading when looking at the consequences of poor mental health. Having inadequate services in place for children and young people who have mental health problems is not excusable. The effect on their development and life chances is severe, and Malcolm Chisholm talked about the American research into this. We also know that our prison statistics show that the vast majority of prisoners have mental health problems. Our inability to deal with mental health issues at an early age creates problems for the future as well as a cost to our society. But the cost to the person affected is immeasurable. Those who give evidence were clear that the mental health of children and young people, a framework for promotion, prevention and care, was the right way forward. However, the problem was its implementation. The Government is committed to implement it by 2015. The long lead-in time means that the work towards its implementation is often patchy and inconsistent, and the Committee are keen that interim targets be put in place to ensure progress is measured, and this would also allow for inconsistencies to be identified. Waiting times are also far too long. For example, in Highland, some people, as we've heard before, are waiting for an outpatient appointment for over a year. And this is unacceptable for an adult, but it's more so for a child in its formative years. Each day, week or month that goes without intervention makes that intervention more difficult and makes the treatment longer. The committee report also talked about the lack of research and the need to increase staffing levels to allow research time, as well as cut waiting times and increase service provision. Research is fundamental to improve the way in which treatment is offered, and it's a false economy to reduce research in order to increase patient care. Both are required. And possibly the most unacceptable wait is that for the reports to the Children's Panel. When young people find themselves at a Children's Panel, they're already at crisis point. The panel need to be able to react quickly and intervene to address the situation those young people find themselves in. Waiting times of up to 5 months were quoted in evidence. This is too long for a young person already in crisis. Staffing levels directly affecting service delivery and research work, and also the work of the Children's Panel. Therefore, we need more investment in training and recruitment of professionals to increase this workforce. The committee also looked at the transition from CAMS to adult services, and it became obvious that those two services worked very differently, and many young people had difficulties with the transition. There were several aspects to this: the handover, the way of dealing with patients in both services, and the way in which patients could be transferred. Children's service often have a broader definition of mental health, which we've already heard, and it doesn't fit easily with adult service provision. Action for Children made the point that it's important to keep this wide definition within children's services to allow for the early intervention. It surely must be possible for professionals from both services to work together to draw up a single pathway geared towards the needs of the individual. And we often hear in our casework of families that feel abandoned when a child leaves school and falls into adult service provision, the lack of support and advice, the lack of protected workplaces or indeed college places. The committee were frustrated by this and have recommended the setting up of a transitional service to bridge the gap between young people's services and adult services. We've heard also that for many years, and we've been discussing it for many years, the effect of stigma attached to mental health issues. And Action for Children tell us that work needs to be carried out locally and nationally to deal with this, and I really agree with this statement. If we don't deal with it, those needing help will be reluctant to ask for it. And because of this, it's even more crucial to have an immediate response to those who ask for help, given that they may already have suffered in silence for some time. School counselling is also one way of providing help in familiar settings, which helps to tackle the removal of a stigma. However, the British Association of Counselling and Psychotherapy tell us that Scotland is lagging behind. They say the Government of Wales and Northern Ireland have in place national strategies for school counselling and its implementation, and provide ring-fenced funding for the provision of those services in every secondary school. We need to ensure we keep pace and provide this service to all children. There are many other issues that have not been touched on in the report: services to deaf people, tailored services for those who suffer from anorexia. Both groups need to travel out of Scotland for specialist care. At a time when people need the support to their families and friends, this can only hamper their recovery. We need those services locally. I feel the committee's report is sound and well balanced, and I would therefore appeal to the Government to implement the recommendations of the report.